Welcome to the presentation of the two end-user applications developed as part of use case 1 called Emergency in a Foreign Country. The first application is called Health Professional Application or HPA and the second one CUREX Patient Application or PA. Today we are going to present you an overview on the prototypes of the two applications. HPA and PA show in practice how the health sector across Europe can be unified, resulting in an easy, secure and quick treatment of the patient wherever they travel. HPA and PA, as the last part of the whole CUREX infrastructure, enhance patients' trust by providing a secure environment that respects GDPR rules, making sure that no personal data is stored or transferred. Most importantly, PA provides the patient with a full overview of the medical exchange request and requires their consent in order for a medical exchange to happen. But what happens if the patient is unconscious or unable to provide their consent due to their health condition? Even in the case of emergency, HPA will still treat the patient and make sure the doctor can justify the reason for such an action, while the PA will provide all the information of what has happened to the patient at a later point in time. The HPA, the dedicated application for the health professional, is a desktop application that gives them the ability to initiate a new medical records exchange request to the patient's hospital of origin, and at the same time it gives them a full overview and history of all the medical exchange requests created by them and their statuses. It also acts as a node for the blockchain network, where each node will store a copy of the distributed ledger. The PA, the dedicated application for the patient, is a mobile application that gives the patient a full overview of a medical exchange request and control the whole process by giving their consent or not. The PA is interfaced with a private blockchain in order to store the patient's consent as a separate entry. Let's start with the use case 1 scenario. An individual from Spain is spending a few days in Sweden for business. While he's there, he starts feeling unwell. He visits a medical center's outpatient, where he is initially administered for examination by the center staff. There he provides his European health insurance card, which once received by the doctor, he is asked some preliminary questions. For today's demonstration, we have already created a doctor's, a patient's, as well as their hospital profiles. The doctor then logs into the health professional application with his credentials. After the successful login, the doctor can now proceed to the creation of a new medical exchange request by inputting the patient's full name or their European Health Insurance Card ID, marking the region and clicking the Creation button. If everything goes well, the doctor will be able to see the newly created request under his Pending tab, and can also review its status, which is now pending for patient's approval. During the creation of a new medical exchange request and before it is created, many background checks happen. HPA backend informs blockchain that a new request is going to happen. Then the private blockchain will check the risk acceptance criteria between the two hospitals. If the risk is accepted, the private blockchain will inform the HPA with the new status and the request is created successfully. At this point, the doctor asks the patient to log in to the CUREX patient application in order to approve the request. After the successful login into the PA, the patient can now see and review the newly created request under the Pending tab of their dashboard and can either approve or reject it. He accepts it. If everything goes well, then the patient can see the accepted request under the Accepted tab. The PA backend informs blockchain for the new status of the request that reflects the patient's answer. At the same time, in the HPA, the doctor can see the request moving under the Accepted tab of his dashboard and the change of its status. We now wait for the medical records to be exchanged between the two hospitals. After this step is completed, the doctor will treat the patient. After the treatment is also completed, the doctor will close the request. All the request steps with their new statuses will be recorded in the blockchain till the medical records have been transferred successfully to the remote hospital and the doctor terminates the transaction. Now we've seen all the functional details of HPA and PA, let's dive into the technical background starting from the overall architecture. Starting from bottom up, inside the hospitals, the HPA desktop application instances are available for the hospital personnel to use. The PA mobile application is available for every patient to obtain and use whenever there is a need for a medical records exchange. HPA and PA applications contain only the front-end part, while all the back-end logic is handled by the central server that you see inside the cloud. Inside the cloud, along with the central server, there is also the authentication server and the application database. The application database contains only the medical exchange request information and all the user application settings. For the authentication purposes, we will use the Red Hat Keycloak server as the authentication server. Two Keycloak instances exist, one for the HPA and PA functionality and one for the blockchain. The HPA and PA Keycloak instance contains the user credentials as well as their personal details required for authentication. The central server, as its name implies, is the central point of all communications. It is the responsible component for communicating with the HPA and PA Keycloak instance through its API to obtain all authentication-related information. It provides and retrieves all the required information from the two applications and handles the communication with the private blockchain. We distinguish our endpoints in two main categories, the internal and the external. Internal are the endpoints between the central server and the two applications front-end part, while external are the endpoints between the central server and the Keycloak or the private blockchain.
Let's see our endpoints in detail. The first category is the authentication category that contains all the endpoints that refer to the Keycloak authentication server. The post session enables the user to log into the server based on the credentials provided, a correct combination of their email and password. The put session allows the user to register and be able to use the applications. The post refresh is responsible to refresh the session of the user without logging them out of the system. And finally, the delete session endpoint that destroys the user session. After successful logging, a user now has access to the below endpoints based on their user type. We have two user types, a doctor and a patient. The post-transaction is accessible only by a doctor and creates a new transaction request to the patient's hospital of origin. With this one, every user can see and query all of their transactions that are associated with them and also can limit the return transactions from the server. They can also query for a specific transaction given its ID. The endpoint of the transaction status change has different permission levels based on which stage it currently is. Certain statuses are handled only by the server and not from the users. With this one, a patient can approve or reject a certain transaction request. We do have other endpoints that help the two application to run smoothly. For example, the get patient searches for a certain patient and is going to be used when a doctor creates a new request. The two applications can also retrieve a patient given its ID or a doctor given its ID. We can also change the application settings by changing the user language or getting the user's profile. We can also retrieve all the hospitals or a certain hospital by its ID.